Please welcome to the Chess 2025 stage, Dr. Walt Whitman and the Soul Children of Chicago.
Good morning, good morning. We are the Soul Children of Chicago, and it is our honor to share our voices with you today. As singers, our breath is our foundation. Every note, every harmony, and every powerful chord begins with healthy lungs and the gift of air. And just as you dedicate your work to advancing lung health, we dedicate ours to lifting up voices in song, reminding us that when we breathe deeply and work together, we create something greater than ourselves. You can download this track right now called We Live Here, Soul Children of Chicago. And I want you to just, when you hear it, just get right on into it. Let's go. On behalf of our choir and our city, we want to welcome you to the city of Chicago. Welcome. No matter where life takes you, there's one place that brings you back. Chicago. Soul Children. I know it's early. Y'all can get your body to moving. You know, get your chest to. Because this is our home, Chicago. Oh, we live here. Tell them about it. Come on. Where we work, where we play, nobody knows. This place. Where we live here. I don't know what you heard about Chicago, but we're going to show you. This is the history. Let's go. Now, I know y'all in the Eric Crown Theater. Can y'all just put your hands together like this? Come on, this. It's where we ground. And you don't have to even be scared if you want to stand up. You can do all of that too. Come on. This place is where we live. We live here. Let's go. It's a city of big shoulders.
Something tonight, oh. There's nothing like this city. There's nothing like no home. We live here, where we grow, where we work, where we play. Nobody knows this place, yeah. It's where we live. Oh, 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 we live here. It's where we grow up, where we work, where we play. Nobody knows. Oh, we live here. Nobody knows. Sweet home Chicago. We live here. Welcome to Chicago.
In 1935, Murray Kornfeld, a tuberculosis survivor, envisioned a society of professionals who would come together to teach and advance thoracic medicine. By 1937, the name American College of Chest Physicians is officially adopted for the society. In 1943, the FCCP designation was introduced to honor those demonstrating excellence in the field, reinforcing their commitment to advancing chest medicine. Seeing a growth in need for international collaboration, this meeting served to advance the exchange of ideas between clinicians worldwide. Chest contributed to legislation that shaped public opinion on the harmful realities of tobacco use. In the 1990s, Chest helped in the ban of smoking on domestic flights and launched its first series of clinical research grants. And in 2014, Chest opened the doors to a new global headquarters, which is the home of the Simulation and Training Center. As we reflect on all that we have accomplished, we take pride in celebrating these milestones. With a clear vision, we now turn our focus towards an even brighter future. 90 years later, Chest remains at the forefront of research and education, with 22,000 clinicians working together to improve patient care and outcomes. You are the past and the future of Chest.
Please welcome the chair of the Scientific Program Committee, Dr. Sandy Khurana.
Good morning, everyone. Welcome to Chest 2025. Congratulate yourselves. I'm sure you got your steps already in today. It's indeed an honor to welcome you all to Chicago, the city of bold ideas and boundless innovation, from the world's first skyscraper to cutting-edge advances in medicine. Chicago has always been a place where vision meets action. It's therefore only fitting that we gather here to celebrate the 90th anniversary of the American College of Chest Physicians, a major milestone that honors the past and looks ahead to a bright future of discovery, collaboration, and progress in our field. Of course, Chicago is also famous for its food. And while you'll find here deep dish pizza, Italian beef, and some of the best hot dogs in the world, when in Chicago, a word of caution, please do not ask for ketchup on your hot dog. Around here, I'm told it's not a condiment, it's a crime. But in all seriousness, just as Chicago's spirit of innovation has shaped so many industries, the work of every single person in this room continues to shape progress and improve the care of our patients. So it's really such a joy to be here with all of you at a meeting where we value science, respect expertise, and come together to share what we know for the good of our patients. One of the things I love the most about this community, about this meeting, is watching this community grow and all of the new faces we see each year. In fact, if you're here for your first Chest annual meeting, please go ahead and raise your hands. This is amazing. Look around. These colleagues are joining a global community of clinicians, educators, researchers, innovators, people who care deeply about advancing patient care and lifelong learning. Now, many of you are here because of your mentors who guided you, challenged you, maybe even pushed you a little bit to present your work or take on that leadership role. Mentorship is the heartbeat of our community, and this week is a perfect time to thank your mentors and become one for someone else. Thank you. I personally am deeply grateful to my own mentors and sponsors who've invested in me, and many of them are present in the room today. I really wouldn't be here without their support, so thank you. All right, so now let's talk about how to make the most of your time here. The best way, hands down, is by downloading the Chest Annual Meeting app. Through the app, you can build and customize your schedule, connect with your colleagues, and learn about Chest initiatives. If it is happening at the Chest meeting, you'll find it in the app. So it'll include events like Monday's Network Mixer, where you meet your future Chest friends and colleagues. On Monday night, again, we will be celebrating Diwali at the Cultures and Communities reception. This is a reception that celebrates Chest interest groups. Diwali is an Indian festival of light. And of course, the ever-popular Chest Challenge on Tuesday, where fellows will compete for the glory that is the Rosen Cup. And I must say, this year, all finalists are competing for the first time. And, interesting fact, they all also happen to have bovines as their mascot. So please, I know. Cast your vote for your favorite and whose bovine is best. It's a friendly competition that's supporting chest philanthropy. There are so many incredible offerings at this year's meeting, and just to highlight a couple, please check out the Experts Unscripted. It's a casual roundtable conversation with experts sharing their approach to complex clinical dilemmas, and of course, the highly innovative simulation courses. They offer one-of-a-kind hands-on training that you really can't get from a book or a lecture. Every CHEST meeting builds on the successes of the previous years. It's the momentum from Hawaii and Boston that we built upon for Chicago. And although I'm the one who gets to stand here and share this with you, really none of this would be possible without the amazing CHEST team and the scientific program committee. They've worked tirelessly all year to bring you the amazing experience for you. And I'm also very grateful to Amy and Mauricio. They're our chairs for CHEST 2026 in Phoenix and 2027 in Vancouver, and they've been with me on this ride this entire year. And this meeting really will be one to remember, and before I leave you, I want to bring it back to why we're here. It feels all too often these days that we live in a time where evidence and expertise are sometimes questioned. But in this room, we share a common truth. Science matters because our patients matter, and the work we do together, learning, mentoring, innovating matters. So let's make this week count. Let's learn together, inspire each other, and leave here better clinicians, better educators, and better advocates for our patients. So again, welcome to CHEST 2025. And this time, please help me welcome CHEST President and my dear friend, Dr. John Howington.
Can I get a hug? Thank you, Sandy. Good morning, everyone. It's wonderful to look out and see so many smiling faces. This year's meeting is truly remarkable, the largest CHEST exhibit hall to date. Be sure and check it out during your time here. An outstanding attendance that reflects the strength and commitment of our community. It's such a joy to welcome you to Chicago, the city that CHEST calls home, with our headquarters in Glenview just a few miles north of here. A city that embodies innovation and connection, and a city that declared today, October 19, Love Your Lungs Day. That's right, I'm proud to share that Chicago's mayor, Brandon Johnson, formally signed off on October 19th can be known as Love Your Lungs Day, a day to raise awareness for lung health and to honor and recognize our members and the work that they do. We shared with him the prevalence of lung disease, not only in the world, but right here in Chicago area. It feels like Chicago is welcoming us with open arms, and what better place to gather for our 90th anniversary, a milestone that honors where we've been and inspires us to envision where we are going. 90 years ago, a tuberculosis patient, Murray Kornfeld, had a bold idea that through collaboration, clinicians could transform patient care. Over the decades, our community has grown from one non-clinician visionary to a global network of physicians, PAs, nurse practitioners, respiratory therapists, industry partners, and more who push the boundaries of what is possible. Today, as we look back, we also look forward with purpose to the next breakthroughs, the next partnerships, the next opportunities to advance patient care. This meeting is not only about learning, it's also about connection. So many of our stories begin with a simple handshake and an opportunity. Think about the people in your career who extended that hand. For me, it was my co-resident, John Snyder, that reconnected me to Dr. Sandra Wilsey in 1997. She was serving as the program chair of the annual meeting in New Orleans and served as a program director for pulmonary and critical care at Truman Medical Center, where we did our general surgery training. Sandra asked me to co-moderate a thoracic surgery session with a senior surgeon at my first CHEST annual meeting. As a surgeon and a graduating fellow, I didn't know if this was the place for me, but I accepted the opportunity that was presented to me. Due to adventures in planes, trains, and automobiles, I wound up moderating solo. As a first-year attending 4 months out of training. Yes, that was intimidating, as the meeting can be for so many of us who are early in our career. But I believe that opportunity is a key reason why I stand before you today. Thank you, John. Another connection from that meeting is Dr. Robert Cerfolio. As a young attendant, he was presenting his first oral presentation at a national conference. It was his first paper on management of postoperative air leaks, comparing water seal to suction. And at the end of that session, Robert was both curious and bold. He approached me at the stage and said, "Who are you?" I said, "I'm John Howington." He goes, "I know who you are, but how did you get on that stage?" And I explained the story to him. And we realized that we both were dedicated general thoracic surgeons. We both had met our wives as interns in surgery training, and our children were the same ages. So from that came 30 years of collaboration, collegiality, and maybe a little competition. Thank you, sir, for being bold and curious. For Anissa Das, it was co-moderating a session with Dr. Nancy Collop that made a lasting impact on her as a physician. For Dr. Mohammed Adrish, it was a connection made with Dr. Nick Hanania that led to a job opportunity later in their career. And for Dr. Stephanie Levine, an introduction to Drs. Richard Irwin and John Hefner kicked off what would be a tremendous tenure within this organization. Throughout the meeting, I encourage you to think about your own handshakes. Think back to the conversation, the mentor, or the colleague who opened a door for you. And then ask yourself, how can you be that person for someone else at this meeting and beyond? Whether in the hallways, during a session, or at an evening event, each connection you make can further a career, spark an idea that could change the life of a patient. And beyond these few days, I want to invite you to consider how you might stay connected to CHEST. I encourage you to make connections throughout this meeting in which you can share your time and your talent by mentoring, by volunteering, by lending your expertise to advance our shared mission. And today, we celebrate those who have done just that, those who have committed themselves to excellence, service, and leadership. It is my honor to introduce the 2025 Fellows of the American College of Chest Physicians. Congratulations. I'm proud to share this year we welcomed 122 FCCPs, representing 7 countries and 31 states. In honor of our long-standing tradition, new fellows, please join me in the pledge. In accepting the fellowship of the American College of Chest Physicians, I dedicate myself to the mission and vision of the college. I accept the responsibility to be a lifelong learner in the disciplines related to chest medicine and others so that I can maintain professional and ethical standards of excellence and provide optimal care for my patients. I will work in harmony with the college as a teacher and advocate, and I will assist and support the college in global efforts to advance patient care, support research, promote diversity to optimize health, and foster health equity. I join my colleagues in the American College of Chest Physicians with pride and enthusiasm. On behalf of the college, congratulations to you all. I want to now take some time to recognize our 2025 award recipients. At CHEST, it's important to recognize our volunteer leaders and educators. It showcases their expertise and commitment while reinforcing a culture of collaboration that drives our mission forward. As president, I have the opportunity to bestow an individual with a presidential citation. This citation is given to a person who has dedicated their time and talent to CHEST. It is my pleasure to award the 2025 presidential citation to my friend and fellow thoracic surgeon, Dr. Frank Detterbeck. Dr. Detterbeck is a professor of surgery and chief of thoracic surgery at Yale University. The major focus of his career has been thoracic oncology. I've known Frank for over 20 years, and his passion and work ethic are truly remarkable. He promotes evidence-based care, teamwork, and collaboration, and this has led him to be a lead contributor in the evolution of chest lung cancer guideline portfolio. Frank has been at the forefront of improving lung cancer staging and addressing the toughest challenges facing physicians on the front line of providing care of patients with lung cancer. It is my great honor to present Frank with the 2025 Presidential Citation. Thank you, my friend.
Thank you.
Congratulations on your well-deserved honor.
Yes.
You're a good man, sir. The Alfred Sofer Award for Editorial Excellence recognizes individuals who have made significant contributions to the Chest Journal. This year, we recognize Dr. Darcy Marciniak. Dr. Marciniak is an internationally recognized expert in clinical exercise physiology, COPD, and pulmonary rehabilitation. He is a distinguished author, an engaging speaker, and a past president of CHEST. For the past 6 years, he served as the deputy editor of Outreach for the journal, in which he identified and solicited quality research for publication and was integral in creating the journal's commentary section. Congratulations, Darcy. Thank you, sir. The Early Career Clinician Educator Award recognizes the achievements of a clinician educator who has demonstrated their commitment to education and development. This year's award goes to Dr. Alice Gallo. Dr. Gallo has made remarkable contributions in her early career. Her research spans from advancements in mechanical ventilation to novel cancer therapies, resulting in numerous peer-reviewed publications, book chapters, and abstracts. In her role as Associate Program Director of the Internal Medicine Residency at the Mayo Clinic, she is deeply committed to training and inspiring the next generation of physicians. Her passion for medical education extends beyond the classroom, as she has built a strong educational presence on social media. Dr. Gallo serves as the Vice Chair of the Critical Care Network and has been a valued CHEST faculty member since 2019. Congratulations, Dr. Gallo. Welcome. Love the jacket.
Thank you. Had to bring the sass.
All right. The Master Clinician Educator Award recognizes long-term significant contributions as an educator and leader. This year's recipient is Dr. Mangala Narasimhan. Thank you. Dr. Narasimhan has been instrumental in shaping the education of thousands of learners through her work in curriculum design and evaluation for CHESS point-of-care ultrasonography courses. She has represented CHESS internationally, showcasing our simulation-based education, and played a key role in developing the certification of completion curriculum programs. Her leadership has been evident as the chair of the Ultrasonography Domain Task Force and the Live Learning Subcommittee. Currently, she serves as the Senior Vice President of Critical Care Services at Northwell Health. Congratulations, Dr. Narasimhan. Congratulations.
Thank you.
You're welcome. All right. The College Medalist Award honors an individual for their meritorious service in furthering work in chest medicine. This year's award goes to Dr. Carolyn D'Ambrosio. Thank you. Dr. D'Ambrosio is the Associate Vice Chair of Medicine for Education at the Miller School of Medicine at the University of Miami and is a widely recognized sleep expert. Her research explores the intersection of sleep in menopause, sleep in disordered breathing, and sleep in breathing in infants. Within CHEST, she's held numerous leadership roles. She currently co-chairs 2 sleep guidelines, serves on the board of advisors, and is associate editor of the Pulmonary and Open Access Journal. Most recently, she chaired sleep medicine board review courses. Congratulations, Dr. D'Ambrosio, on receiving this honor.
Thank you.
You're welcome. Beautiful dress.
Thank you.
You're welcome. The Distinguished Service Award is given to a member who has made exceptional contributions to CHEST and devoted so much of themselves to improve the organization. This year we recognize Dr. Mike Nelson. Dr. Nelson's, yes, please. All right. Dr. Nelson's dedication to CHEST spans more than 35 years and is truly unparalleled. Over the course of his service, he is committed to nearly every committee within the organization, including his role as president of the CHEST Foundation, now CHEST Philanthropy. With a strong interest in the business of medicine, he has collaborated with us in shaping CHEST advocacy efforts. As a member of the Board of Regents, he continues to demonstrate unwavering commitment both to CHEST and the profession. Congratulations, Mike, on receiving this well-deserved award, my friend. Receiving the Master FCCP designation is CHEST's highest achievement. It's an honor and privilege to award this year's Master FCCP to Dr. Stephanie Levine. Woo! Dr. Levine has exemplified excellence in every area recognized by this award, including service to CHEST, dedicated contributions to the journal, impactful education, and professional prominence in clinical, academic, and educational leadership in pulmonary medicine. Her leadership within CHEST is extensive, most notably serving as president during the challenging early days of the COVID-19 pandemic, which thrust her into the global spotlight as the face of CHEST, helping to share vital education. Her unwavering commitment to both our profession and to the college has left a lasting impact, and we are deeply grateful for her contributions. Please help me congratulate Dr. Stephanie Levine on receiving CHEST's highest honor today. Well deserved. You're welcome. Our organization would not be where we are today without our clinician educators. I want to take a moment to recognize a group of CHEST educators who have made tremendous contributions over the past years. These individuals have dedicated countless hours sharing their collective wisdom and expertise in designing and delivering CHEST programs. For this, and so much more, they have earned our deepest appreciation. The 2025 Distinguished CHEST Educators recipients represent the top 3% of CHEST international faculty. This year, we recognized 222 individuals, 32 of whom are receiving the designation for the first time. We are truly grateful for all faculty whose commitment advances CHEST as a global leader in clinical education. As our community continues to grow, so does our philanthropic support of projects that are improving patient care in communities throughout the world. This year's 2025 Community Impact Grant recipients are leading important initiatives ranging from tuberculosis screening and improving lung health literacy in children to supporting post-lung transplant patient kits, advancing youth lung health education in the Cheyenne River Sioux Tribe, and providing children with tracheostomies the chance to experience a traditional summer camp. Once again, congratulations to all of this year's honorees. By now, you've had a chance to learn a bit more about the sessions, the networking, and the energy of this meeting. What strikes me every year is how quickly these days begin to shape our collective future. That is why I want to take this time to focus less on where we have been and more on where we are going together as CHEST and together as a field. As I reflect on my year as president, I am deeply honored and profoundly grateful to serve as your 87th president. I am both humbled by and proud of what we have accomplished together. We have stood firmly as advocates for our patients. This year, CHEST strongly supported the SOAR, or Supplemental Oxygen Access Reform Act, working to ensure patients have timely access to the oxygen they need to live full lives. We also fought and succeeded to ensure that patients with COPD can receive the most appropriate non-invasive ventilation therapies without delay. This is not a small victory. It is life-changing improvements in care. At our headquarters, we're securing a more sustainable future with brand new solar panels. These panels are expected to generate 300,000 kilowatts per year, drastically reducing our use of traditional energy sources. As thoracic and pulmonary specialists, we all see the toll that pollution takes on respiratory health, and I'm proud to help lead the charge at CHEST to do our part in reducing that burden. Throughout the year, education and advancement of our workforce have been at the forefront. I'm proud to share that CHEST launched new educational materials and for the first time ever, a certification exam specifically for advanced practice providers in critical care. This certification is a milestone, elevating standards, recognizing excellence, and ensuring that patients benefit from the very best expertise at the bedside from the entire care team. We received national recognition for our CHEST education, the first 5 minutes cultural humility modules, earning a Power of Association's Power of Conscious Inclusion Award from the American Society of Association Executives. These modules take the tenets of the first 5 minutes program on communicating more effectively with our patients and lean into different elements that play into relationship building, dividing into topics of race, gender, perceived bias, and more. Seeing our work earn recognition is a true testament to the value behind the education and the programming we create. CHEST also received the Power of Community Support Award for our Community Connections program, which is happening for its 3rd year at this meeting. You can learn more about the 3 local partners and their incredible work in the CHEST Meeting magazine. During the year, we also collaborated with our respiratory partners around the world to accomplish even more. This included partnering to launch the Lung Health Task Force, led by the Forum of International Respiratory Societies, with Dr. Darcy Marciniak as the CHEST representative. This task force is helping to redefine how lung health is assessed and diagnosed through developing a lung health spirometry toolkit. To learn more, I invite you to visit the FERS website. Even in these challenging times, our unwavering dedication and strengthened collaboration among associations ensure that patients continue to receive the highest quality of care. In just a few moments, you'll hear from our keynote speaker, Sean Swarner. Sean is a 2-time cancer survivor, and he achieved what many thought was impossible, becoming the first cancer survivor to summit Mount Everest, even after losing most of his right lung during his cancer treatments. Sean's story is one of grit, resilience, and hope. His journey aligns with our mission at CHEST and with the work we all do every day for our patients. Last November, in partnership with the White Ribbon Project, CHEST proudly displayed white ribbons at our headquarters to raise awareness for lung cancer and expand the conversation around screening eligibility. We will again have these ribbons displayed next month, and I encourage you, help us share the message far and wide. I work with lung cancer every day, and I see the struggles of the patients who are impacted. Sean embodies the spirit of perseverance that it takes to face cancer head on, and I cannot wait for you to hear his story. But before I get to that, I want to again encourage you to make the most of this meeting. Beyond encouraging you to make connections, I want to challenge you to ask more of yourself. Challenge yourself to stay curious and be willing to take on the work even when the odds seem against you. Push yourself for more accurate diagnoses, advanced procedures, better care, and better patient outcomes. Curiosity is not just an attribute, it's the engine of progress. From curiosity comes knowledge, and from knowledge comes opportunity. That is how we move from proficiency, competence, to excellence. People often ask me why I chose this path. Early in my general surgery training, I recognized I needed to move on from my inward focus of my dream of being a doctor to finding a purpose and a calling in my future career. John Snyder came in knowing he wanted to be a cardiac surgeon. I had exposure to general thoracic surgery, and I enjoyed that work. My research at the time identified in the early 1990s there was a drastic shortage of general thoracic surgeons. I now had a field that interested me and needed support. I had found my calling. For me, it was my passion for improving lung cancer care and my desire to make a difference in thoracic surgery. Early in my thoracic surgery training at Vanderbilt and early in my career, colleagues questioned my decision to pursue general thoracic surgery. They pointed out that cardiac surgery was more lucrative, but I was drawn to the complexity of thoracic disease and the urgent need for better care. Overall survival for lung cancer at the time was less than 15%. At the time, open thoracotomies were the standard for lung cancer surgery. It was the only way I was trained to do the operation. And I saw firsthand early in my career how debilitating they were for patients, and I couldn't accept that as the only option. That is why I became an early adopter of video-assisted thoracic surgery, VATS lobectomy. My partner Mike Reed and I sought additional training from pioneers like Rob McKenna, Tommy D'Amico, and Scott Swanson. Some joked that it simply transferred the pain from the patient to the surgeon. But for me, it was about something much greater, advancing patient outcomes and comfort, keeping that outward focus on the patient. We worked with many other thoracic surgeons to refine the technique, and we trained our partners, residents, fellows, and surgeons from around the area on how to transition to minimally invasive surgery. And more than a decade later, when my team and I had mastered VATS, we didn't stop there. We pushed further, heeding the advice of Dr. Sofolio, Rob Hedrick, John Alexander, and others, embraced retraining in robotic lobectomy, which offered patients even faster recovery, often reducing hospital stays by up to 2 days, and improved results like fewer complications in our hands. It was painful to go back through a learning curve in my 50s, but it was well worth it. It has always been about challenging ourselves, never settling, always striving to do better for our patients. That outward focus, allowing us to work harder, strive higher, and keep pursuing excellence in care and outcomes. This year, we're working with Dr. Shanda Blackman at Baylor, Dr. Rob Hedrick at CHI Memorial, my partners, and thoracic surgeons across 100 hospitals with Common Spirit to standardize thoracic surgery enhanced recovery programs to further reduce complications and advance patient care. Now I want to turn this back to you. Why did you enter this field? Was it passion, altruism, curiosity? Whatever it was, hold on to it. Those qualities, the ones that brought you here, are the same ones that will drive the next generation of discovery, compassion, and care. As you move through your career, don't lose sight of those motivations. Take the time to teach, mentor, share your expertise, and be sure to share the why you're doing a certain technique or you use a certain approach, not just how it is done. By doing so, you not only advance yourself, but also you elevate the entire field. Remember your why and let it guide you in everything you do here at CHEST and beyond. This year, we celebrate CHEST's 90th anniversary. That is a milestone worth honoring. But this celebration is not about looking backward. It's about looking ahead. CHEST has been advancing patient care and professional growth for 9 decades. But I want us to imagine what lies ahead. Where will you be when CHEST turns 100? What can you achieve in the next 10 years for yourself, for your patients, for your community? It all begins here. It begins today. Before I close, I want to extend a truly heartfelt thank you to some of the most important people in my life. To my lifelong friends, thank you for being my anchor, celebrating every success, and lifting me up through every challenge. My present and former partners, especially John Alexander, who recruited me at a CHEST event to be a thoracic surgery chief here in Chicago, and later got me involved in CHEST philanthropy leadership. My former chairman, Jeff Matthews, who opened the door to community engagement and leadership through Leadership Cincinnati. Dr. Mark Talamonte, who trusted me to develop and lead surgical quality at North Shore Health System, now Endeavor Health. Working together, we changed the culture to one of quality, accountability, and improved patient outcomes. To my current team at Virginia Mason Franciscan Health, this group, thank you for your unwavering support, commitment to excellence, and gracious patience towards my frequent absences this year, and I've been gone a lot. To my fellow CHEST leaders, it's inspiring to witness all the remarkable achievements you are making in the world. To my wife, Ann, our 2 children, George and Grace, you are my rock, my constant source of strength, and the reason I stand here today. To my bride, Ann, at 26, I made a bold move and said, if you're ever going to lose that guy, I'd love to go out with you. I'm more than married up. I married someone better than myself, and I've been reaping the rewards for 35 years. You are the love of my life, the woman of my dreams, and the answer to my prayers. I'd be lost without you. Thank you. And to my former residents, I gained much more than I gave in my time and experiences with each one of you. In closing, as we embark on this year's meeting, I ask you to make the most of every handshake, every conversation, every learning opportunity. Challenge yourself, stay curious, stay passionate, and never forget your why. Together, we will continue to shape the future of chest medicine and the field. Thank you. And now it is my great honor to formally introduce our keynote speaker, Sean Swarner. As I previously mentioned, Sean is a two-time cancer survivor. His first goal was to crawl 8 feet from the hospital bed to the bathroom. He has gone well beyond that goal by climbing 29,035 feet to the top of Mount Everest with one lung. Since then, he stood atop the highest point on all 7 continents, the 7 summits, and even completed the Hawaiian Ironman. You may have noticed in a bunch of the pictures, mountains and some of us on steep cliffs. That last slide before this was a group of residents of mine from the University of Cincinnati. And Dr. Chip Huffman was a fireman and paramedic here in Chicago for 10 years, and then a medic in the Special Forces in the Army prior to going to medical school, so non-traditional intern, a true American hero. He showed up at my door, like John Snyder, knew he wanted to do cardiac surgery, and said he'd like for me to be his mentor. And oh, by the way, I want to climb to the 7 summits. I heard you like hiking. Maybe you'd like to go out to Washington State and do a training climb with me. I didn't even know the 7 summits was a thing. Before you know it, a few years later, I spent 15 days on Aconcagua in Argentina, and then that picture you saw was Mount Elbrus, high in the mountains, with Chip Huffman, Prakash Bangali, and Tom Houston. Since then, we've toned it down, and we do 14ers in Colorado. But we know firsthand the grit, resilience, and the will it takes to get to that summit. So now let's hear from him, Sean Swarner, on his remarkable journey, a message of healing, hope, and triumph.
As a 13-year-old, the doctors gave me 3 months to live.
He had just lost everything, and he had lost his hope.
Going in for a checkup for the first cancer, they found a second cancer. The doctors gave me 14 days to live.
He said, "Mom, if I don't make it, I've had a good life." And I said to Sean, I said, "You're gonna make it." Didn't want to lose my little baby.
The cancer could take my body, but it could never touch my mind. I'm cured of cancer, but I'm not done fighting it. And I'm going to continue fighting it just to give people hope and let them see what's possible. Well, I've completed the highest mountain on every continent, which is the 7 summits, and I've trekked to the bottom of the Earth, the South Pole. I only have the North Pole left.
Two polar bears sniffing around. One of the team has seen the prints, and 2 of the bears approached one of the camps.
Sun doesn't really do a good job of warming anything up. The only time this usually works is when it's about -40.
There's 5 of us on this expedition. There was originally 6, and unfortunately one person's had to be evacuated. But it's a relentless place, the frozen ocean, absolutely relentless. Takes no prisoners.
No cancer survivor's ever done the Adventure Grand Slam before. It's something that needs to be done, proving that you can go to literally the ends of the earth to give people hope.
And now, please welcome to the stage, Sean Swarner.
Wow. How's it going out there? Feeling a little bit cold right about now? Funny thing about, well, backstage, I'll mention this real quick. We were talking backstage. She's like, "Thank you so much for wearing the shirt." And I was like, "Yeah, love your lung." So, funny story about what you just saw. It's a trailer for an Amazon film called True North, the Sean Swarner story. And if you want to watch it and you have Amazon Prime, go for it. If they're charging 99 cents, $3, I don't get any royalties from it, so there's a free version on YouTube. Just go to YouTube and watch it from there. But the interesting thing about being up in the Arctic, it's a very large place. And I remember skiing along, pulling that 200-pound sled behind me. The culmination of the Explorers Grand Slam, which is the 7 summits in the North and South Poles, which I still think sounds like a Denny's breakfast platter, but I didn't name it. So as we're skiing, pulling that sled behind us, we get a call from the folks who were in the helicopter, kind of wandering around, checking out the area, and they say, "You guys got 2 polar bears following you." Uh-huh. So we're sitting there at camp trying to figure out how these polar bears in this giant area called the Arctic know where we are. See, when you're going, like I said, pulling that sled, every time you stop for a break, you take off your boots, or you take off your skis, back up onto the sled, sit down on the sled, unzip the front of it. That's where your food is. Fuel is in the back. You don't want to mix the two. Pull out this food, stick the chocolate in one side of your mouth, and while that's melting, because it's so cold up there, while that's melting, you put the nuts and cheese and sausage on the other side. Chew those down. And up there, everything's a weight issue. You want things to be light, right? So I'm sitting here thinking, 2, 3, 4, probably got 4 more stops before we set camp. Take out some food, dump it, put it back in, start skiing north again. Next stop, do the same thing. Sit back down, weigh the bag, think, I don't need this, dump that down. Continue forward. Last stop, about an hour before we set up camp for the night, we're gonna have some proper food. We call them dehydrated nasties. So we dump out the bag, continue forward. Every single person on the trip was doing the same thing. And we're trying to figure out how these polar bears were tracking us. Another funny thing that happened. It was the first expedition. You saw the guy with the snot sickle? Technical term. So as we're laying in the tent, it was the first time I ever brought a firearm. And we didn't use it, thankfully. But when it's that cold, it got to about 80 below. And when we were laying in the tent, I pretend I'm laying down, we're practicing with these giant gloves on, because if you have any exposed skin and it grabs metal when it's that cold, it essentially freezes, but it burns your skin. So we're practicing, laying in the tent, picking up the firearm, flipping off the safety, and getting ready. And I'm doing the same thing over here. Giant gloves on, so we have to practice this thing. He's doing the same thing getting ready. I'm doing the same thing getting ready. He's doing it over here. And then all of a sudden, I start hysterically laughing. He's like, man, what the hell's wrong with you? We got 2 polar bears out there. I'm like, yeah, but we're practicing like the polar bear's gonna come to the front of the tent, unzip the tent, like, hey guys, got room for me? But one thing that we didn't allow into our minds, and this is where anxiety comes from, we never went to bed wondering, what if? What if those polar bears come into our tent? What if this happens? What if that happens? How many people get stuck in that cycle? What if this? What if that? What if this? What if that? What if it doesn't happen? So I'm going to take you through a little 30-minute, 25-minute, and 40-second story of my whole life. Can I have more time for this, please? My life began in a small town in Ohio. My backyard was a cornfield or a bean field, depending on the season. I was completely normal until I was going out for a layup in basketball, came down, something snapped in my knee. That knee injury triggered every joint in my body to go so haywire, it swelled up, Mom and Dad didn't even recognize their own son. Took me to the local hospital. I grew up in a town called Willard, Ohio. Anybody ever heard of Willard? Yeah, I didn't think so. So we had about 3 or 4 stoplights. Population at the time was about 5,000, and by now it's probably up to a whopping 5,004. But they stuck me in the local hospital, treated me for pneumonia. And you're not going to cure cancer by sucking on a nebulizer. Wasn't getting any better, but because I was in the 8th grade, the cheerleaders were coming in, my friends were coming in. I was like, being sick is great. Teachers came in, started giving me the homework. I was like, all right, we got to get over this. Took me to Columbus, Ohio, and eventually diagnosed me with advanced stage 4 Hodgkin's lymphoma. And they told my parents that their firstborn son has 3 months to live. Numbers, right? I had an expiration date of 3 months. I remember one morning waking up at home, sitting on my bed, and something caught my eye off to the left side, and where my head was laying the night before was just covered in hair. I knew my hair was going to fall out from the chemotherapy. So I ran into the bathroom and looked at myself in the mirror, and first of all, I couldn't recognize who was looking back at me. I was 60 pounds overweight. My hair was falling out in chunks. I had nothing left of who I used to be. Went into the shower, turned on the shower, and quick side note, I didn't find this out until much later. That pillow that had all the hair on it, for 3 months before that, every time I was in the shower, my mom would come and she would replace that pillowcase so I wouldn't notice my hair falling out. Pretty cool. So I'm in the shower, the water is hitting my hair, and then things started changing. It no longer hit the hair and soaked into my scalp, it was just hitting my scalp. And some guys know exactly what I'm talking about in here. And I remember just feeling completely deflated. I fell to my hands and knees. My hair was clogging the drain, the water was rising up, and I was sobbing. I had no hope, I had nothing left. And I started thinking, what were my friends doing when they were getting ready for school that same day that I was sick? Do you remember being in the 8th grade, freshman year in high school? What were your biggest issues, your biggest concerns? Maybe not getting picked on, being popular. I think back then it was, do you remember the Reebok pump? Remember those commercials? So my neighbor, Jerry, across the street, 2 houses down, was probably at home going, 26, 27, 28. Like, perfect. Now flash back to that young man on the bottom of the shower floor. I remember thinking I had 2 choices. I could fight for my life or give up and die. The latter is not an option. And I also projected into the future 3 months and pictured my mom, my dad, and my brother without me in their lives. And that's when everything changed. That's when the switch in perspective changed. I no longer wanted to focus on not dying. I wanted to focus on living. That simple shift in perspective changed my whole life. About a year and a half later, thanks to the miracle of modern medicine, family support, prayer, and just an inner will to get up out of the hospital, I walked out a hairless, happy, bloated young man. I wish I could say that was the end of the story, but unfortunately it's not. I remember going in for a checkup for the first cancer when they found a second cancer, completely unrelated to the first one. This time around, I remember going in, and one day they found a tumor on an x-ray, right on my right lung. The tumor on an x-ray, did a needle biopsy, took out another lymph node, put in another Hickman catheter, cracked open my rib, did a thoracotomy, cracked open my rib, removed the tumor, put a drainage tube in, and started chemotherapy in less than 1 day. This time around, they diagnosed me with a type of cancer that affects 3 out of 1 million people. And I remember the doctors, after putting the numbers together, basically said that I had a 99.999999999% chance of dying. So in my mind, I'm thinking, I have a 0.000000001% chance of survival. So you're telling me there's a chance. This time around, they diagnosed me with 4th stage Askins sarcoma, gave me 14 days to live. Man of the cloth came in the hospital, read me my last rites. Hospital wanted me to put together a living will. And I have a brother who's 3 years younger than I am. I remember looking at my mom and my dad thinking, isn't Seth going to get all my hand-me-downs anyhow? Like, what does the hospital want? 3 months of intense chemotherapy, 1 month of intense radiation therapy that just bombarded my right lung, which is why I have one big bulldog lung over here. It's amazing how the body can adapt, if you believe it can. Went through about another 10 more months of chemotherapy, and because the treatments were so harsh, I'm going Monday, Tuesday, Wednesday, Thursday, Friday. Be released, go back home, recover, go back in. Friday, Saturday, Sunday, Monday. That's one cycle. Because no one's ever had Hodgkin's and Askins sarcoma before, they didn't know what was going to happen. The treatments were so harsh, they put me in a medically induced coma for a year. Every time I was in the hospital, I don't remember being 16 years old. Now, granted, some people probably wish they could forget being 16, but I don't have that luxury. But again, thanks to the miracle of modern medicine, family support, and just that inner will to move forward, I walked back out into remission and became normal. We're not going to discuss my college years for good reason. I started off molecular biology, took organic chemistry, immunology, and has anyone ever seen the movie Animal House? Who knew it was difficult to pass immunology and organic chemistry if you didn't open a book? So I switched to psychology, and I wanted to help people with this. Because as we all know, cancer is not an individual disease. It's a family journey. How many people here wake up in the morning and have a routine they go through? Yeah? How many people here when they go to bed have a routine they go through? How many people, keep your hands up, if your morning routine starts off by grabbing your phone and looking at the news? How many people, keep your hand up, when they go to bed, the last thing they look at is their phone? Waking up on a negative note, going to bed on a negative note, you're programming and bookending your day on a negative note. How much of the news is positive? 0.0000001%? If you don't program your brain, outside sources will do that for you. In the first 15 minutes when you wake up, steal my line if you want to. The instant my eyes open, I tell myself, the past is gone, there's nothing I can do about it. Tomorrow may never come. No matter what happens today, today is the best day ever. And whose choice is it to make it that way? So going through these cancers taught me a lot about life. And because I'm not going to discuss the fun times that I had in college, we will jump ahead from the setback to the adventure. But where I learned everything going through the cancers, I took into the mountains. And we'll begin after I somehow got sponsorship in Kathmandu. one thing I do want to mention is you see that thing behind my ear right there? I just pulled it out. A couple weeks ago, I was in New Orleans, and a guy came up to me afterwards, and he said, I can't believe you smoke. I was like, what are you talking about, man? He's like, I saw a cigarette you pulled out behind your ear. I was like, that's a big pen. So now I want to make sure, and I actually looked at him. I don't smoke, but I said this to him. I was like, 2 cancers, 1 lung, what are you thinking, 3 packs a day? So when we got to Kathmandu, I wanted to see if I was on the right path in life, to see if I could start helping, inspire, and motivate, and give hope to cancer patients. Everywhere I go around the world, I do my best to visit local hospitals and talk to the patients directly, because there's this reciprocity of hope and inspiration that flows between us. So the next day, the doctor told the patients, we're going to be leaving and heading up to Lukla to start our trek up to base camp. And it's interesting because has anyone ever seen I think it was Nat Geo or Discovery, they did a series on the world's most dangerous airports? Yeah, this was number 1. And the reason it's so dangerous is because in the middle of the Himalayan mountains, when you make this airport, the runway is at an angle like this. At one end are the Himalayan mountains, and at the other end is a cliff. And when you look out the window, you can actually see old fuselages laying at the bottom. And I know I didn't sell it very well with that video, but if anyone's interested, in April, I'm taking a group up to Everest Base Camp. And since I don't have much time, we went from hiking up from Lukla to base camp. We went from Lukla to Pakding, Pakding to Namche Bazaar, Namche to Tami, Tami to Namche, Namche to Kumjun, Kumjun, Devashe, Devashe, Dingbache, Dingbache, Chakun, Chakun, Lobashe, Lobashe, Kork, Shep, and Kork, Shep, base camp. So, finally, when we got to Everest Base Camp, 17,600 feet. This was going to be my home for the next month and a half in a tent that moves 4 feet a day. Has anyone else not showered for 4 weeks? And if you have, please don't raise your hand. What's amazing about going up this mountain is you have to take your time. It's very similar to going through a chemo treatment. Go to the hospital, get the treatment, go home, recover, blood counts go up, go back in. When you go up a very high mountain like this, you go up the mountain, come back down, recover. Blood counts get higher. It makes your body more efficient. Go up the mountain again. So every time we left base camp, we would go with a full backpack, drop stuff off, come back down with an empty backpack. We could rest for a day, 2 days, 3 days, 4 days, whatever. So our schedule was we went from base camp to the top of the icefall, back to base camp, rested. Base camp up to camp 1, 1 night, back to base camp. Base camp up to camp 1, 1 night, just below camp 2, back to base camp. Base camp up to camp 2, 2 nights, back to base camp. Base camp up to camp 2, 2 nights, back to base camp. Base camp up to camp 2, 2 nights, just below camp 3, back to base camp. Base camp up to camp 2, 2 nights, back to base camp. Base camp up to camp 2, 2 nights, up to camp 3, 1 night, back to base camp. And while we're climbing this thing, the temperatures can go from 80 to minus 40. It can go from 70 degrees to 0 in 5 minutes. Anyone been skiing? I live in Colorado. Anyone been to Colorado skiing in the wintertime? Yeah, you get into the sun, right? It feels hot. You come home with that sexy raccoon tan. Now imagine going from 12,000 feet up to 20 or 23,000 feet. I had a friend at the Hillary Step. He took off his glacier glasses for 2 minutes. Snow blindness. The sun burnt his corneas. Avalanches every single day. And next time you hop in a pressurized tin can and you're flying through the stratosphere, and the captain comes over the announcement system and says, "We reached our cruising altitude of 29,000 feet. Look up the window and up 35 more feet. Everest is at an altitude where jumbo jets level off and fly." And I was getting ready to attempt something that people thought was impossible. They literally said, "Sean, it is physiologically impossible to climb Mount Everest with 1 lung." Well, I think that's a reflection of how they feel about their own abilities. The Khumbu Icefall, the most dangerous section of the climb. You know what it sounds like when you have a glass of ice and you pour some water in there, right? That snapping and popping and grinding sound. Now imagine, if you could, a chunk of ice the size of this room, snapping and popping and grinding. The Khumbu Icefall is like downtown Chicago on a 45-degree angle. All the buildings are giant chunks of ice called seracs, also moving at 4 feet a day. So let's say you have, it's not the Sears Tower, it's the Willis Tower. Let's say you have the Willis Tower moving 4 feet a day, laying on its side, and it comes to a little ledge. It's going to fall and destroy everything in its path. We were up there once on a chunk of ice about this big, between these two speakers and right about here, from here to here. And I remember it started grinding and popping and snapping. And you know how sometimes you feed off of each other's energy, right? Like energy is contagious, attitude is contagious. When one person gets excited, you start getting excited. And the other person starts getting more excited, you start getting more excited. Like, I don't know why he's excited, but I'm excited. I'm excited because he's excited. It works the other way around, too. While we were standing on this chunk of ice, there was a ladder. The lady was going down, taking her time. I was with Kami Sherpa. And he started getting nervous, which made me more nervous, which made him more nervous, which made me more nervous. And I heard him over here going, Om Mani Padme Hum, which means hail to the jewel of the lotus. And in my mind, I'm thinking, the hell's he afraid of? He believes in reincarnation. So he's getting more nervous. He's going, Om Mani Padme Hum. I'm going, Our Father who art in heaven. It's like, woman, you got to go. He went down the ladder. I went down the ladder. And the moment we were safe on everything below, on the platform below, everything we were standing on disappeared. It fell into a giant crevasse. And sometimes to cross these huge gaping holes in the ground, in the ice, you put ladders across them. Anyone afraid of heights? Couple hands. Let me rephrase the question. Who's afraid of aluminum ladders tied together spanning crevasses? There we go. So when we were ready to go for the summit, we got up to a wonderful vacation destination called the Death Zone. And the Death Zone is any altitude from 26,000 feet on up. Brain cells die in this altitude, fat melts away, muscle melts away. I'm about 6'1", 6'2". When I climbed Mount Everest, I was still 6'1", 6'2", but about 185 pounds. Let's just say the whole trip took about 3 months. I came back weighing about 150 pounds. I needed 12,000 calories a day just to maintain my weight. You know, they don't have Burger King over there. So when we got here, the goal was to wake up and hike up the mountain in the middle of the night. And in the back of my mind, all I'm hearing is, you can't do it. It's impossible. We slept through our alarm clocks. We woke up about 3 hours after everybody else left, who was on the same schedule as us to go for the summit. And I remember coming out of the tent and looking at the mountain. And on the side of the mountain, because it's the middle of the night, all the climbers had their white headlamps on. And it was like a string of white Christmas lights on the side of the mountain. Beautiful. Had my oxygen mask on, started heading up. And I remember we caught the last group of climbers. We unclipped from the fixed rope, leapfrogged around them, caught another group, leapfrogged around them, and I was the third person that season to summit. And I remember there was one time called, on a section of ice called the balcony. It was a knife ridge where about 6 feet over here, it dropped straight down 2 miles into Tibet. And on this side, I dropped 1.5 miles straight down into Nepal. And then, I'm going to preface this already. I wasn't going to mention it, but I'm going to preface it by saying this is a very bad joke. In the climbing industry, we have a very interesting sense of humor. 2 miles over here, 1.5 miles over here. They say, if you get to that point and you want to live longer, fall off to the right side. Wait for it. So we're going up 2 miles, 1.5 miles, anyhow. We're going up. I hit this ridge, and I can't feel from my knees to my toes, frozen. At that point, I thought I was going to lose my toes. I thought I was going to lose my feet to frostbite. They're going to have to amputate my feet. And I remember just kicking the blood to my toes, trying to get blood to my appendages. And I remember looking out to my right side. I call it the great heater in the sky. The sun started coming up. And I remember looking out, and it was a sea of clouds with mountain peaks as islands. The most beautiful orange, red, yellow, blue, purple, pink, most amazing sunrise I've ever seen in my entire life. And from that altitude, from that high, I remember looking a little bit closer, and I could see the curvature of the earth. The horizon wasn't flat. And I'm thinking, it can't get any better than this, until I looked off to my left side, and straight out, without looking up, straight out at eye level, were stars. Stars at eye level. The most amazing sunrise of my entire life on the right. And I'm in this moment, and I'm thinking to myself, this is amazing. I started getting emotional. Huge mistake. Started crying. Tears froze to my face. The moisture from my eyeballs froze the inside of my glasses. Changed them out and continued up the mountain. I remember reaching the summit and looking back down at that 13-year-old on his hands and knees fighting for his life, where his first goal was to crawl 8 feet from the hospital bed to the bathroom, and now he's standing 29,000 feet on top of the world. Because I had a deeper purpose. I wasn't climbing for myself. Every step of the way, I had a flag about this big that had names of people touched by cancer, folded up in my chest pocket close to my heart as a constant reminder of my goal, my inspiration, my hope. And I left that flag, the off-colored yellow in the middle, left that flag at the summit of the world, forever commemorating the struggle of cancer patients worldwide. And the next thought I had to myself was, I got to go back down. Climbing is a round-trip sport. Summiting is optional. Returning is mandatory. So then I climbed the highest mountain on every continent, took a flag to the top of each one of those. Again, a higher purpose, a deeper meaning behind it. Then I completed the World Championship Ironman Triathlon in Hawaii. Then skied to the South Pole, then skied to the North Pole, as you saw on the film. Then about 10 months ago, I ran 7 marathons on all 7 continents in 7 days. I didn't misspeak. 7 marathons, 7 days, all 7 continents. So I'm not here to convince you to climb any mountains or run any marathons. I'm here to remind you that you've already conquered your impossible. Because every single person here has survived 100% of life's most difficult challenges. Think about that. Because that's a pretty amazing record. So the question next time is, can you climb? It's will you climb? So the next time life puts a mountain in front of you and you're standing down here looking at the top, stop standing there looking at it, strap your boots on, put them on, lace them up, and get moving. The mountain's not going to climb itself. But one thing I can guarantee you is when you do get to the top, and I mean the real summit, the true summit, not the false summit, the one that means something to you, that gives you purpose. When you climb to the true summit and you look out at the view, it is worth every single seemingly impossible step. Have a wonderful conference. Oh, wait.
Please welcome back to the stage Chest President Dr. John Howington.
Thank you. You're awesome. Thank you, Sean, for sharing your powerful story with us. I hope each of you have a wonderful experience over the next few days. And I hope to convince my family and friends to join me and Sean on a trek up to the top of Kilimanjaro.
Hold up a second. John, we got something to say about that. You know, this is nice, all the speeches and all this stuff, but you haven't officially welcomed these people to Chicago.
That's what we need to do. Welcome, everybody.
The first thing we got to do is turn you into an honorary blues brother.
Sometimes you got to say,
Welcome, Brother
what
John.
Looks pretty good, don't it?
Yeah, now get out of here. We got stuff to do, all right? We want you guys to enjoy the city, so the best way we can do that is to play this track and have you welcome to Chicago. Come on, baby, don't you wanna go?
You got it.
Well, come on, baby, don't you wanna go back to that same old place, sweet old Chicago? Well, come on, baby, don't you wanna go? Howdy, hey, baby, don't you wanna go back to that same old place, sweet old Chicago?
Take it, Jake.
Well, 1 and 1 is 2, 2 and 6 is 8. Having Chest here in Chicago sure is great. Howdy, hey, baby, don't you wanna go back to that same old place, sweet old Chicago? Well, come on, baby, don't you wanna go? Well, come on, baby, don't you wanna go back to that same old place, sweet old Chicago? Elwood Blues on the heart. When I sing, come on, you guys sing. Baby, don't you wanna go? This is the audience participation part. I sing, come on, you guys sing. Baby, don't you wanna go?
I can't hear you.
Then I'll sing, back to that same old place, and you sing, sweet old Chicago. Let's see if this works. Well, come on, baby, don't you wanna go? You sound lovely. Well, come on, baby, don't you wanna go? Sound like your lungs are working. Back to that same old place,
Sweet home, Chicago.
nice job.
Well, 6 and 3 is 9. 9 and 9 is 18. Look there, brother, baby, I'm gonna see what I see.
Howdy, hey, baby, don't you wanna go back to that same old place, sweet old Chicago? Well, come on, baby, don't you wanna go?
Oh, yeah.
Well, come on, baby, don't you wanna go back to that same old place, sweet old Chicago? One more time, well, come on, baby, don't you wanna go same old place. My sweet home, Chicago. Time for all y'all to head right out those back doors and see what Chicago has to offer. Good morning. Thanks for coming to Chicago.
Thanks, everybody.